A second for it to come up. Let me know if you see me. Okay, so I'm on. Perfect. All right, we're alive. Oh, my dad's here before you are. My dad. All right. Ooh, and Danny Benyamini too. See, now we got to be on our A game. Okay, so this lovely bearded individual over here is Dr. Kyle Stanley. If you guys, well, I'm sure most of you are familiar with him, but he is one of LA's top cosmetic dentists and worldwide lecturers. He's a professor at the University of Southern California, where every time I post something with him, I get probably 20 messages from his students saying, "Oh my God, that's my teacher. Did you know he was a model?" And I said, "Yep, I knew that." So, Dr.
Everyone's wondering how that was the case when they see me now, right?
with the beard. This
Yeah.
is what the movie Contagion does
Will
to
do to
you.
you.
So, yeah. So Dr. Stanley lives here in LA and got his practice up on Sunset Boulevard with a beautiful view, and we've traveled several times together to lecture worldwide. And the big achievement I'd say that we've had together is really showing the camaraderie and the collaboration between dentists and plastic surgeons. Beyond that, before I even got to know Dr. Stanley, he was actually the doctor who was the first in the dental world to really go around and teach everybody about the soft tissue components around the mouth, namely lip lift. So people were doing kind of dental work without realizing that maybe you can't just keep playing with the teeth. You got to worry about what's around it too. So that's why I think this will be a great discussion to have with you. And for everybody who wants, you can leave questions down below in that little question box, and we'll try to answer them at the end. So Dr. Stanley, Kyle, tell me the whole mission. I know how we met, but how did you get to that point?
Yeah, I started analyzing faces early on in dental school, and I realized when I was, I think, first year in dental school that we were already doing something wrong, in that I was just learning about teeth, and I wasn't learning about soft tissue profiles or too much about orthodontic surgery or any other type of surgery that happens on the face. And so I really wanted to look into how I could bring the dental world together with the plastic surgeon world or the plastic surgery world or medical world in general. And the lip lift was really the first thing that I found that was like, okay, we need to be talking about this. You know, dentists need to know about it. Plastic surgeons need to know about it because, as you know, a lot of plastic surgeons a few years ago weren't doing this. And that was it. And that was what my mission started. People thought I was absolutely crazy in the dental world. They're like, why are you showing us plastic surgery journals and articles? And it's caught on in the last 2 years. So my mission is starting to happen.
Yeah, and I'd say a big message for us to even start out with in this broadcast is that it is very ignorant or irresponsible to think that you can be a good cosmetic dentist and contribute to facial aesthetic without understanding the entire face, without looking at everything. If you don't know what makes someone beautiful, if you don't know what makes someone balanced, how are you just going to go and do like a little Mr. Potato Head and grab one little, teeth and shove them into the middle of the face? It's inappropriate. So for those dentists out there who really just focus on teeth and only teeth, you're really missing the big picture. And from what we've seen huge advances on people that go to your seminars and to Christian Coachman seminars and understanding the beauty of the whole face and how to get the teeth to be there to match, to sit there and really fit in to the surrounding structures as opposed to just thinking of teeth alone.
It's been like an awakening in dentistry in the last, let's say 3 years when I started. I guess people started to listen because I've been talking about this for 10 years, but people started to listen about 3 years ago. I think Christian helped me, when Christian kind of brought me into some of his symposiums and things, people started to listen. And once they get it, it's like you can't unsee it. And they immediately get it. They know what to do. I think the hardest part now from the dental world is, and this is hard for me too, is finding plastic surgeons that are willing to listen to you. Because I think the same thing in dentistry is we have blinders on, and it's the same thing in plastic surgery. It's like, well, you do the teeth, you do the face, and we'll just figure it out as we go.
Right, and it's similar in the plastic surgery world within itself. If you want to make someone truly balanced and beautiful and do the best for them, and let's say you're a rhinoplasty specialist and you don't do the face, you better know what face procedures there are so you can guide them to say, hey, you need to go see this doctor because he can do this for you. The plastic surgeons, what they need to be aware of and well versed in is orthodontics, prosthodontics, cosmetic dentistry, and really have seen the before and afters from these dentists so they know how they can get the skeleton to contribute to their soft tissue work. Because the soft tissue is not just hanging there by itself, it's dependent upon this skeleton underneath. And they got to know, okay, you know what, this patient needs the maxilla brought forward, there needs impaction to go, they have vertical maxillary excess, their chin is too long, too short. They have to know these things.
Right. Yeah, you bring up a good point. This is something that Christian always talks about. We're talking about Christian Coachman, who's one of our friends, one of my mentors, is that doctors, whether it's dentists or plastic surgeons, don't have to know how to do everything. They just need to know what's possible and who they need to refer to. So like you said, if you only do rhinoplasties or if you only do orthodontic surgery, you don't need to know how to do everything. You just need to know who does it best and what's possible to give your patients ultimately the best result.
And what I've seen from us working together is, or groups of people like us on the East Coast here, is that our patients are getting overall much prettier and much better looking and bigger, better results than they could have otherwise. And we're giving them really the full gamut of options on what to do. And we're not trying to make them look overdone. We're trying to give them the best option for them. Sometimes they're barking up the wrong tree. They're coming to me saying, I need a lip lift. And I say, no.
Yeah, we've had these patients before.
Yeah. And I say, you know what? Your lip is actually great height. Your teeth are why your lip looks like that. Your teeth are too recessed or too short, and you don't have enough projection behind them. So you actually need to go see this person. And I know that because I've seen your work 1,000 times, and I know what's available. So you become more aware of what your patient needs.
Right. Yeah, it's totally true. I started trying to find plastic surgeons to listen to me, like I said, 10 years ago. And it wasn't until we met, years ago that you would got it immediately. And were just cool enough to listen. So once we made that connection, and it took me learning what you do and coming to your practice, you learning what I do and, being at the symposiums and things. And now we know what's possible and can give patients best results. And it's been nice to see other teams around the world. We have the New York team, we have Spain team, Brazil team that are incorporating this. And it's super cool to see the idea spread.
Yeah, we're all nice little smile teams everywhere. And speaking of connection, your connection on the Instagram side is a little fuzzy. I don't know, maybe.
Is it?
Is it your Wi-Fi or maybe go off airplane? People want to see that pretty face. Even my grandma is on here. Yeah. All right, so let's see. It's reload. So join the group again. Let's see if that comes through as an invitation. Perfect. All right. Perfect. Yep. You're better
we're
now.
Back.
So that's what he looks like, everybody. so the reason I was talking
They're all disappointed now.
So the reason I was talking about all that and the interplay and the approach to everything is I look at a lot of jacked up mouths all day long. Every day I see.
My son's taking that.
Yeah, oh, that's so cute. So I see human beings with horses' teeth.
Yeah.
Like someone did a transplant from a horse or a chipmunk or something, put it inside of a person. What's contributing to this look? this overdone veneer,
Yeah.
just grill look, and then why is it happening?
One reason that's happening is kind of the stuff that we do, and they're not thinking about lips and teeth together. So one reason is that the lip is so long that patients come and say, hey, I want to have, I want to show teeth when I talk or teeth when I smile. And so they ignore the lip and just make the teeth longer. Oh yeah, we can make you look younger. We can make the teeth longer, 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 longer. And, oftentimes these are, let's say, men or women in their 50s or even 60s, and they have this aging, senile upper lip, and the dentists just think, oh, well, I just need to have that 1 to 2 millimeters of show at rest, so I'll just make the teeth longer. That's the problem. The teeth are too short. So there's that aspect of it, right? Not thinking about the oral facial aspect. And then I think there's just the lack of knowledge in true natural aesthetics. So doctors actually looking at natural teeth. It's been so long that doctors have been looking at like the beautiful ideal is what the best lab technician makes, that they've actually forgotten what a good natural smile looks like, which should be our overall goal, right? We want our patients to come out of your practice or out of my practice and their friends say, you look amazing, not, I love your veneers or great nose job, And it's just going back to nature, I think.
You should look soft and pleasant for other people to look at. And this goes with facial plastic surgery, the shadows on the face, over-operating, putting too much Botox or filler in, you look like this. These are not pleasant looks. Nobody wants to look at you. And with big, fat fucking veneers, like nobody wants to look at those chompers. It is not that far off from It's Something About Mary, where,
or the mask.
Or the mask, where you just have these big, giant grills. They're not done in a delicate way, nor are they done in a natural way. And I've learned a lot about natural composites and veneers and that kind of stuff just because I've been watching your guys' lectures, and I see them. And now it bothers me when somebody comes into my office and they come to me for like a facelift, and they say, well, what do you think is going to make me look better? Can you give me just general opinion? And that's a very dangerous thing to ask me, because I don't want to,
let me start picking you apart, right?
Yeah,
it's not good for anybody's psyche.
Sometimes I'm like, you know what? Listen, I'm doing you a favor. I go, you look fake as fuck. I don't say it as that, but I'm like, you look so fake because your teeth. And it's just as simple as the dentist you went to at that time in their career maybe wasn't doing the best work. So I would just go get reevaluated, talk to somebody who does some natural work. And I think that alone is going to make you nicer to look at for everybody, including yourself. You're just going to look softer. You're not going to look like, like this bright, shiny, radiant.
Sometimes, and especially like where we practice, we have to talk patients out of that because, it's very difficult. Oftentimes they want that fake look. It's going away more, but, I'd say 5 or 10 years ago, this fake look was kind of like a flex on like, I can afford to get treatment done, right? Overdone nose, crazy Botox, crazy facelift, veneers that were insane. Now I think people are going back to this natural look, so it's nice to see that in general society. People want to look natural, want to look more subtle.
Yeah, so we got to remember, it is not just dentistry. It is an art, and if you see the really, really good doctors who do this stuff, you're blown away. At these lectures we go to, the understanding of facial aesthetics is greater than any plastic surgery meeting I've ever been to. And plastic surgeons don't get that. They don't see that because they go to these generic plastic surgery meetings. The ones I've come to where dentists and dental practitioners in general, orthodontic, are teaching and lecturing are the ones that I've learned the most. And not just me, anybody I've brought to them, they say the same exact thing. They say, holy shit, I never looked at symmetry that way. I never looked at balance of the face that way and really understood.
I take a lot of pride in
flow
that.
means.
It was really fun, like at the Orofacial Club meetings, sitting next to you, sitting next to Javi, sitting next to the other plastic surgeons, and seeing you guys comment on like the photography and the ideology behind some of the stuff that our team was doing. So I took a lot of pride in that.
Yeah, it's
It made
awesome,
me
and it
proud as a
changes.
dentist, you know. We could teach plastic surgeons something. That was fun.
Yeah, and it really changes the way you practice. It's not a little tidbit of information that I got. It changed the way I do things. It changed the way I see things. And all it takes is even that one lecture, if we were to repeat it over and over and over again,
Yeah.
you'd be teaching hundreds and hundreds and hundreds of different doctors who have never opened their eyes that way. It allows me to even have that conversation about symmetry. So
Hmm.
if there's any plastic surgeons listening, you've heard this. People come and ask you about facial symmetry, and you just want to stab yourself in the eye or directly in the brain when this happens. It is unless you're just not a good plastic surgeon and you thrive on thinking symmetry is actually beauty,
Yeah.
then whatever, go live in your sheltered world. But the rest of us who have a realistic understanding of symmetry go crazy when we hear that question, because you're never going to win against symmetry. And even if you were to win the battle of symmetry, symmetry is not what's giving this person their
No.
imbalance, or the look that they want to get or improve. It has nothing to do with it. And when I came and listened to you guys, I got a very, very clear understanding of that, and a very easy way out of it, where I can talk to a patient now and just explain to them, say, listen, no, no, no. I go,
Yeah.
I know you think it's symmetry. I go, and I tell them it's, trying to fix your symmetry is like trying to be not right-handed anymore. Like it's part of human nature to have different functions on each side of our body, different strengths. You can't get symmetry. What you're seeing, though, or what you should look for, is how everything comes together.
Yeah.
How
And I
everything
think,
comes
are
together.
you having Bruno on soon?
Yeah, so I was going to talk
Yeah.
with Bruno on, I think
Cool.
on Monday, and
Great.
then Javi on Sunday, tomorrow. So the
Awesome.
different
Cool.
aspects of it.
The
So we're going to go
Spanish team.
into detail about it. Yeah.
Yeah, well, when I
So,
first saw Bruno speak about facial flow, which is, I think, one of the concepts you were alluding to,
mhm.
again, changed my whole way of how I look at everybody, not even in dentistry, but just how I analyze faces as I'm walking around or watching movies or something. Super cool concept. I'm sure you guys will go into that when Bruno's on.
Yeah. So let's say we're looking at a normal mouth. You know what?
Hmm.
You can just tell me. I'm going to put up a couple of slides that we found on your beautiful presentation. So this is something that you'd like to talk on, the missing link. So
Yeah. Yeah, this
what
slide
is the
actually
missing link
comes from
when you're
Christian
lecturing?
Coachman. This slide comes from Christian Coachman. And this is what's missing in dentistry. And I think you could have the reverse aspect of it in plastic surgery, where you have a face with no mouth, is that we think about our patients, yeah, just like, yeah, look like a blow-up doll. We think about our patients as just a mouth, right? We fix the teeth, we fix the gums, we make the bite right, and then we hope that it just looks good at the end and that it fits with the face. And that's just not how it works. And so in dentistry, and this all starts with dental schools, really, because that's how dental schools are teaching, is we need to be teaching to the face, and that we are part of a facial team. We don't do everything, but we're part of a facial team. And this is just kind of a thing that makes people laugh, but it's very serious. It's what you see, how someone gives someone nice, new, young-looking teeth, and they have an old mouth and an old face. You can still give an older patient younger-looking teeth, but then we have to do things to the face to have that balance. And that's what the missing link is.
Yeah. Yeah, I think your goal as a plastic surgeon should be to give your patients the best overall aesthetic they can get.
Exactly.
And you can't ignore the eyes just as
Right.
much as you can't ignore the mouth. And for the dentist, similarly, you can't just say, okay, well, I made your teeth pretty good. Go.
Right.
Now
You
you're
look so much
fantastic.
younger. Great.
Yeah, you look so much younger with your big, bright white teeth. Like, you really have to balance everything nicely. And let's see if we can see that little guy. Okay, what's this graph about that we're looking at?
Okay, so this graph is interesting, and this is what I bring up. Now, plastic surgeons know this, but this is something that dentists don't know. And this is how, as we age, we show less upper teeth. You can see it going do, or I guess do, and more lower teeth, like this. So I always talk about how, the lips oftentimes move down as we age. So we're showing less upper teeth, more lower teeth, which makes you look older. Now, in addition, the teeth are oftentimes appearing to move up. And why that is because we have abrasion, attrition, erosion. As we grind or have acidic erosion happening, the teeth get shorter. So we have this problem happening where the lips coming down and the teeth are going up. Our patients are looking older, and they come to us, so they come to a team like ours, and they want to know, how can I look younger? How can I restore my mouth to a more aesthetic position, more aesthetic feel? And this is just some research showing what the average tooth show is from the upper and the lower teeth.
Okay, so for people to understand very clearly, not only is the upper lip drooping over time, but the entire aperture of the mouth, meaning the commissure, the aperture, is actually sinking down, where you're seeing more of these lower teeth and
Yep.
less of the upper. And
Yep.
you're seeing more darkness and lower gums and things that you really don't want to see because it makes you look old.
Yeah, and I always, I post stuff about how Disney really understands beauty and how they know how to age people and make them young, and they do this with old people too. They show only lower teeth. They make them have really long upper lips. They project their lower jaw more because their mouth kind of sinks in, and they really understand this. And that's how we think of when we think of older patients, like they took their dentures out, right?
So comparing a young look versus an old look. So my face is in front of this. I could switch it around, but you can see over here.
Yeah.
So
Yeah. So
what we're
here
seeing,
you have classic young look, right? A lot of tooth display at rest, more than most of our dental colleagues are taught to do, which is interesting because most of us are taught to design smiles so that we have 1 to 2 millimeters at rest. But when you look at like the upper echelon of beautiful people, they show like 6, 7 millimeters even sometimes. Most of these are younger women, but we need to understand, like you said, you need to know what makes someone beautiful in order to recreate that in someone who maybe wasn't born with that or has got in a car accident or something. They've lost that beauty. And then when you go to an older patient, you probably have that on the next slide, you see this happen, only showing lower teeth, no upper tooth display at rest, very long upper philtrum. And this was how you and I first got talking, is because I have many patients that come, and every dentist has this, that comes to their practice that looks like that, but they want to look like the younger patient. And so what dentists do is they just lengthen the teeth, which is crazy, and it makes them look like they have maxillary excess when they don't. You make them appear to have a skeletal problem when it's simply a soft tissue problem.
Yeah, and I've seen that so many times, and they come in and from here to here it just gets longer and
Longer, yeah.
And the lengthening the teeth is not a good solution for a lip lengthening problem. If the lip is getting longer, you shorten the lip. You don't lengthen the teeth. You don't make everything longer altogether. And I have a lot of patients who have gone through treatments like this, and the worst is the 60, 70-year-old that I see, and they've had a bad facelift already, and they've had a bad nose job already, and not bad, antiquated. It was good 20 years ago.
Right.
And the lip has elongated, but the teeth, you still see them. And I'm like, what the hell is going on?
It's very weird.
And the smile barely moves. You can't really get the lip to function well because it's so long.
Yeah.
And it just gets stuck halfway up these teeth.
And even worse, too, that I guess is something we didn't even talk about, is oftentimes plastic surgeons that don't understand this will do filler in those lips. Say, oh, well, your lips have gotten so thin that we need to do filler now, which even lengthens the lip more. So you have this like tug of war happening. The
even
teeth are
worse.
getting longer, then the lips getting longer, and the teeth's getting longer, the lips getting longer. And the facial thirds are going crazy on this.
Yeah, even worse, they pick Juvederm to do that, which is
by
far the worst. Yeah, by far the worst lip filler you can choose out of our beautiful selection of lip fillers. And the Juvederm migrates into the SMAS and on the muscle, and now you already have a poorly functioning lip that's spread itself out and splayed out like this. On top of that, you're carrying edema within there, so your muscle can't even contract. They're walking around with these loose, floppy lips with zero function.
Yeah,
and
I heard you call them monkey lips before.
Yeah, they're monkey lips. And
yeah.
When we were talking about lip incompetence, there is incompetence in terms of you can't close the mouth, and there can also be incompetence in terms of the muscle just can't move. Your lip doesn't move either way, so it can be too short, too long. And it's really, it takes a lot of experience, I'd say, to start seeing the balance and all these things and how to make somebody nice. But that's why it's great when we kind of, review what the range of beautiful outcomes or
Yeah.
natural aesthetics are, and then we understand there's no correct 1 to 2 millimeter incisive show, 5 millimeters incisive show. There's a range, and the only way to decide that is not to say that you found the right range or you found the right potion for this, is to look at the patient, figure out what things you can do on this person to help them, and within those restraints, like constraints, where you can't do, you know, everything you want to do, you
Yeah.
have constraints. You say, okay, this person with this anatomy, what would happen in my head if I lifted her and gave her 3 more millimeters of tooth show? Would that make her look better or worse? You know, you have to be able to envision these things, and you can't envision those without having done a lot or seen a lot through lectures and combined lectures like we have.
You know, one thing you mentioned that I learned from you, even though I had been talking about this for a long time, is how you have these patients that have to struggle to smile, and how it's a very subtle thing, but when you take away that struggle and they can smile naturally without having to lift that giant lip, how much more naturally they can smile. And that was something that I learned from you that was really cool.
They look like a nicer person.
They're not like
they're
trying
not
to
straining
smile.
when they smile. They have a more pleasant smile, and that's a big deal that I think is often overlooked. People don't understand what a
It's something that's
strain
hard to
is.
teach, right? Hard to teach how to see. But once you know it's there and you start looking for it, then it's a subtle thing, but it makes a big difference.
Yeah, I agree. So something like this. So whose mouth is this that we're looking
So
at?
this was my my old front office. So at the time she was probably 25, I think. And you notice her teeth aren't worn. She has very feminine, big central incisors, and that really nice kind of inverted upper lip.
Yeah, so it's got a beautiful contour to it. What I like to show everybody too when they're going through lip filling and those kind of things from my end is that volume is not what makes a lip sexy. Volume is one of the many things that makes a lip sexy, and to simplify it like that, it's a big mistake because you're missing out on everything else that other people look at when they're looking at you. And so what we're seeing here is you have the curvature of the upper lip as it peaks up into two beautiful peaks. As it curves down, it doesn't go away and disappear on the ends. You see the fullness of the lip all the way to the lateral extent. You see
you also see the corners of her mouth, how nicely turned up they are.
Right. Exactly. So if that upper part were buried, that wouldn't look so good. It would look more centrally exaggerated, not as long and luscious. So the length does matter. Too long is horrible.
Yes.
And then you look at the curvature from the side of the lip as it comes down with a little concavity and comes into a nice gentle slope onto these little peaks, which look like little mountaintops.
Yeah.
And the filtral columns contribute. On the bottom, a lot of practitioners with a simplistic view, they like to fill the bottom to go like this and then have a tubercle and then go back down, which is not sexy. You want this on top, the M shape. Underneath, actually, most people look sexy with it smooth or with just two pillows like that, and it comes into a central small divot.
Yeah, I love showing this picture too because it shows the great ratio of upper lower lips. How you have, you know, she doesn't have super people that come in saying, just fill my upper lip, right? I just want the upper lip done, just the upper lip, right? And, you know, you have these people that start walking around looking like ducks. And when you have that correct ratio, and there's a bunch of people that have tried to put a number on it. Like you said, there's not necessarily a number. It's more of a feeling. You can really have a natural view of this. And she has natural lips and natural teeth. But.
Yeah, and the ratios are a good thing to understand because it's a guideline and it tells you
Starting point.
Starting points to just think about things and see things. So what is the natural ratio for upper and lower lips? Is it 1/3 to 2/3, 2 to 1, 1 to 50/50? So million numbers you could put out there. And my very correct understanding, which is not, you know, I would say this is fact, is that it's a range in there and nobody's going to come up with the right number as to what it is because the right number doesn't exist. I've seen personally going up from 1/3, 2/3 to 50/50, and you stay in a natural range. What I do know is that if the lip looks excessively thin compared to the lower, that's bad.
Right,
If
of
it looks
course.
excessively full to the lower, now you're looking like
That's
you
right.
have an
Yeah.
overbite and you look
Yeah.
terrible. So
Hmm.
50-50, you're usually pushing that natural limit of what people can have. So some people do have 50-50 on their lips naturally, and they might have the most beautiful natural lips in the world actually like
Hmm.
that. But that's not meant for everybody. So you
Yeah.
can't give, I can't give you Angelina Jolie's natural lips.
Yeah. You
It's
sure?
different.
So should I cancel my appointment then?
No, no, come still. I'll sell you
Okay,
something.
good. Okay, good.
But some people have to understand that there's limitations on what you can do on their faces
Yeah.
naturally. We cannot, you're not Mr. Potato Head. We don't take a piece from somebody else and put it on you. We have to look at what you have and enhance what you have within the constraints we have.
Yeah.
Right? And that's how you keep people natural and nice. So what else is it about veneers if you had to like teach people? I'm just stuck on veneers because it's bothering me right
Because
now.
you
But
see it so much.
I see it so much. Veneers and caps. And I had the most beautiful girl I did a consultation with the other day, and her dentist wanted to do veneers on her. But all she had was a tiny little tooth chip on one
Yeah.
little tooth.
Yeah.
And she had beautiful teeth. They were delicate. They were imperfect, which I
Yeah.
love. They were a little jagged here and there, but it matched her face, and she looked adorable and cute.
Yeah.
Um, so I told her, if I were you, I would maybe just get that fixed for now,
Hmm.
and then leave veneers for, when
Yeah.
there's something wrong with your teeth. But what's the big thing that you're seeing when you see veneers that makes you want to puke in your mouth?
Okay, so there's a few things. A lot of them has to do on how the ceramics are done. So what a lot of patients don't understand is that the dentist oftentimes doesn't make the actual ceramics. They have a ceramist or lab technician that does that. And a big thing I see a problem with is texture, over glazing them so they look like super glazed, and they don't reflect light correctly, because natural teeth have all these little imperfections that reflect light that make them look natural and make them look dynamic. And when you see bad ceramics, it looks dead, and just something looks wrong to your face. Another thing that I see is the embrasures being closed too much. So embrasures are like when two teeth come together in between, little like black triangle at the bottom, okay? And a lot of patients ask for this. They'll say, I want it to be flat all across, right? That's another thing. You have no embrasures. So embrasures are a natural thing where the two teeth come together. It makes it look natural and subtle, like you say, a subtle. Um, Another thing is that patients have started asking for straight teeth, okay, at the bottom. And that's not how teeth are. Oftentimes the central incisors, the two in the front, are a little bit longer, 1-2 millimeters longer, especially on women. This is a really beautiful, subtle, kind of sexy look. And when they lengthen the other teeth to match those, it just doesn't look right. It actually makes the patient look older, even though many times they're trying to look younger.
Now, should people know you had veneers?
No, they shouldn't. They shouldn't. And it's the same, I say this with implants or any dentistry. Our goal of dentistry, at least with us, is for our patients to say, you have a beautiful smile. Or our patients' friends to say, you have a
Yeah.
beautiful smile. Not to say, I love your veneers. Our goal is that none of our patients' friends or family know they had veneers.
Yeah. And that's a big thing with plastic surgery too, is you don't want somebody coming and saying, "Oh my God, you look like you had a facelift."
I
And
love
I
your
agree.
facelift.
I love your facelift. Because that means that somebody very tasteless noticed your bad surgery
Right.
and agreed with you. And the same thing goes with veneers. They have to fall into place and they have to match your face and look natural and soft and contribute to everything around it to the point where you think they belong there. They weren't placed there.
Yeah.
Because if
Yeah.
somebody's noticing it, it doesn't mean that they're noticing it because it's beautiful. It's really unlikely that's the case. They notice it because it stands out to them.
Yeah.
And it stands out because there's something off. It's not blending properly.
Mm-hmm.
So, and the other thing, what I love about sending patients to you is when I send them to you, and this is obviously people would think it's like a common thing, is that you say no to
Yeah.
veneers or to caps or to doing any kind of cosmetic stuff to their teeth
Yeah.
because I sent them to you because I thought, well, there's something off about the teeth or it's imperfect.
What can we do?
But you looked at it and you said, yeah, I agree. I see that. But her options would be too extreme for somebody who looks so beautiful already.
Yeah.
So I don't see a big gain in it. So you've weighed the pros and the cons and you've told them to go away.
Yeah.
Okay.
the more I practice, and I've been doing it for 10 years, but the more I practice, I realize how valuable natural teeth are. And I'm sure it's the same with you, natural skin, natural noses, anything. And so I want to do, and I just heard this quote from one of my friends that I did live with, I want to have the best result with the least amount of dentistry. Now, sometimes that could mean, and this is also a quote taken from my friend, that could mean that we have to do a full mouth rehabilitation. We have to treat every tooth. Or that could mean that all the teeth have to come out. It depends on the case, but the goal should always be to do the least amount of dentistry or surgery and have the best result.
Yeah, I agree. And what is the trade-off? Because I would say, you know, if there's no risk, there's no trade-off, then yeah, everybody go get veneers. But can you explain how a veneer is placed, and do you sacrifice something? Do you forever lose something?
Yeah, sometimes yes, sometimes no. So traditionally, veneers were pretty invasive in the sense that you had to remove a lot of the tooth structure on the facial aspect, on the front part. As we've been able to use something called digital smile design, where we can actually plan the treatment in a digital workflow, like basically take the patient's head, put it into the computer, plan everything, see how much we're going to remove, we can plan on doing a more minimally invasive way. So yeah, once enamel's gone, it's never going to come back. Now, veneers can sometimes, I mean, if they're done well, can strengthen teeth. So when we have old teeth that are broken down, that are the wrong color, that are worn, veneers are actually a good thing because they can bring the function back to be correctly, to where the bite can be correct, strengthen the teeth. Now, if they're not bonded correctly, which is something that my partner Manajat is really big on, if they're not bonded correctly, then you're weakening the tooth. So yeah, there's definitely a trade-off here. And you know, once something is gone, it's never going to come back. So as little as possible.
Yeah, so I had somebody offer me veneers once. I kid you not. So what would you say? Like,
no, of course not. I mean, for you, yeah, give me a little bit. That's good. You know, I like your teeth. I like your teeth. You have, and you look at this naturally, you have your centrals are a little bit longer than your laterals. Oftentimes, people want that very, very straight across thing. And, you know, your teeth are bright enough. Have you bleached your teeth?
I did once, like that Zoom
okay.
One time.
Yeah. So, you know, yeah, don't do Zoom. That's not the best way to do it. Custom trays are the way to go. Okay. Yeah, we've done cases together where people have come, and sometimes what it is they want veneers, right? Because they think their teeth don't look good. That may be the gums, actually, to where the gums are going over the teeth too much. Or sometimes people want veneers, but the answer is really orthodontics, or it's orthodontic surgery. And it's something that veneers won't really solve. So it's, in the general population, veneers has become like a term that doesn't necessarily mean what it is. Right. It's like, oh, I got veneers done. And you look at that and you're like, these are all implants, or like, these are all crowns. Like, this is totally different, right?
It just means tooth work now.
Yeah, it's become to mean tooth work. So
yeah, so people understand there are composites, there are veneers, there's caps, okay, there are implants. Yeah. There is there's a lot of gum work you can do as well to recess the gums, to bring them down.
Bring it down. Yeah.
Yeah, there's orthodontics, which you can actually just move the positioning of the teeth, and that can make huge differences in terms of the breadth of the teeth, or just overall positioning and vertical height, everything. I've seen crazy stuff with orthodontics. There is prosthodontics, which falls into the whole, I guess, implant and
doing prosthetics, right? So bigger prosthetics,
And then you have there's perio, which is more of the gum stuff, and then you have
orthodontic surgery.
Then you have orthodontic. Yeah. Orthodontic is a very important thing. So some of the biggest improvements I've seen in terms of somebody who wanted to be pretty, and because I get that a lot, where they come to me and they say, I want to be pretty. And I look at them like, no, you are pretty. Some of the ones that have blown my mind are the orthodontic surgeons.
100%.
Octavio's on this one over here. I think he's listening in Brazil.
Hey, Octavio.
Dude, some of the results I've seen from the orthodontic, there's things that I cannot do. Like I get jealous when I see it and proud. I look at it, I'm like, oh, holy shit, that's an amazing change to make with just moving the jaw back and forth.
Well,
and
I think plastic
position.
surgeons get these patients a lot, get these orthodontic patients that they don't realize what can be done in the dental realm. And usually these are the patients that come in for rhinoplasties, right? They have kind of larger noses, let's say, or maybe they have a hump or hook or whatever it is they don't like. And then they have a recessed chin. And oftentimes they want you to do filler or a chin implant.
Chin implant, right?
When the answer that may be a way of kind of, let's say, polishing it, making it look better. But the true diagnosis is that you have a recessed lower jaw. And once we move the lower jaw forward, then you may not need a chin implant. Or then your nose may actually work with your jaw. And so it's, again, going back and looking at the whole face.
And I follow a lot of these patients because they come to me as part of the treatment plan for either lip lift or facelift, young patients who want a facelift because they're moving the jaw back and forth and they're worried about laxity. And what I've seen is that orthodontics take these tiny little like baby faces that are cute, but they're not pretty. And like it takes them into beautiful, elegant looking structure that you would legitimately see on the likes of Cindy Crawford. Like their amazing structure. And all they did was move their internal structure forward and around a little bit. And all of a sudden their skin looks better, their face is more balanced.
And it changes the projection of the lip too. So sometimes you have these patients that have been getting fillers or chin implants or things done, and then they have orthodontic surgery, and then you have to remove the fillers because you gave them the natural lips that they needed or the natural chin. Yeah, I agree. Orthodontic surgery is very underutilized, and it's so high tech now with guided surgery, and you have like Robert Relli in LA and Octavio in Brazil and Javi in Spain and all these people that are like just absolute artists, minimally invasive treatment, and you can do one surgery and be done with it the rest of your life instead of having to do X, Y, and Z, all these other surgeries and have to do fillers over and over again. It can really be a life-changing thing. Yeah.
So, I think my big message always to plastic surgeons who are willing to listen is that you need to go to these meetings. You need to go at least once. These doctors I know have been going to the same meeting for the past 20 years of Vegas cosmetic surgery and global aesthetics.
Same in dentistry.
Which are amazing. You learn a lot, but it's every once in a while something really blows your mind at those meetings. And there are, but it's every once in a while. Versus you go one time to one of these meetings, like the Orofacial Club, that we did in Brazil, or the one in Miami, like everybody who came loved that. And it will change the way you practice, and it will make your patients love you more. It makes you sound so much smarter in front of patients. Like if you hear the conversations I have with my patients, now it's like they're quicker, they're faster. I can convince people more easily without straining because I know the reality of it. I'm not conjecturing or guessing or missing something. I see it, and I tell them very quickly, and they understand that, oh my God, the way he explained it to me, he does know what he's talking about. I don't need to Google anymore.
Right.
Like he's the expert. He's definitely the expert.
What I love to see from when we first started working together years ago to now is how now you take smile photos, before and after smile photos. And I don't know any other plastic surgeon that does that. I haven't seen anyone. Maybe but
they do it a lot for
such
facial
a difference
stuff. But it's necessary because you have to see the dynamic of the face and how it's moving, and it does help if you have a patient and you're taking them through various phases of their treatment as they're younger to older to look back and say, no, look, this is how your face was functioning then. This is how it's functioning now.
Yeah.
You see how it's sitting. This is the dominance of your face and all that. So as we get to our 45-minute mark, we're going to take some questions. So if anybody wants to pop them down at the bottom, we're happy to answer them. The first question, which is forever a work in progress because it really is case dependent, is what would you recommend going first, the lip lift first or veneers?
We have gone back and forth on this.
Back and forth. Yeah. My quick way of thinking about it is, because you can talk about predictability, about who has the most ability to make a bigger range of difference versus, you know, between the two of us. But let's say someone has short teeth. I say, let me do the lip lift first. I'll maximize what I think would just look good on your face, ignoring your teeth. And then as long as I know that you've already seen the dentist and he said that he can lengthen you to whatever is needed, then that works out better because you can match it. If it's long teeth are a little more difficult to shorten. So I feel like, you know, there's more work that goes into that versus sometimes you'll say I can shave 1 millimeter, half a millimeter, or if I really want to get that 2-3 millimeters now, we got to change the teeth, we got to do impaction, we got to do all this stuff.
Surgery,
exactly. So in that case, if you're shortening, I say you go get that done first, shorten it knowing that, and then I already talked to the dental practitioner saying I can take it this far or this far.
Yeah.
I can do either, so you do whatever you need to do, and I'll do it. That seems to be the most simple way to explain it, but there are so many other...
Yeah, we've gone back and forth on this. I think the main thing is communication, knowing what each other can do, trying to be as predictable as possible, and when we can do a mock-up, we do a mock-up. So like you said, in long teeth, sometimes it's difficult to do a mock-up, or you have to do it and then kind of use black marker to black out where the tooth was but may not be. You may be simulating orthodontic surgery or simulating crown lengthening or ortho, but a mock-up is key in this communication.
Yeah, and if you're going on the lengthening side and your dental practitioner is not familiar with lip lifts, then probably do the lip lift first.
99% aren't. Yeah.
Yeah, because the reflex, and it's a very strong reflex, and yeah, it is somewhere in the 90-something% range.
Yeah.
They're going to make it too long, and then you're kind of limited on what you can do with the lip lift and balancing you. So it's a reflex. This is the way people are taught. It will change the more and more, you know, we're kind of expanding everyone's views. So let's see. As a surgeon, do you use a specific tooth-based landmark to discuss a lip lift at all? Not really. You're looking externally at the soft tissue balance as to what would look good in terms of height of the upper lip in relation to everything around it, the nose, the jaw, the face. And you have to look at the design of the lip itself. Is it buried in the corners? Is it up in the corners? Is it an Asian person who is already centrally exaggerated and gets more centrally exaggerated? There's a bunch of other things for soft tissue. Then you have to look at the actual teeth. Are they ugly teeth? Are they good-looking teeth? And this makes a huge difference, because if you have somebody who has very nasty-looking teeth and you want to make them look better and they're not going to work on their teeth, you can't go expose it all. You have to actually be very delicate on how much you're exposing. You want to leave them covered most of the time, or else people are looking at crooked teeth all day. So there's no tooth, level that we look at when we're trying to define this, but we do know on some people 5-6 millimeter incisor shows too much. On other people it could be perfect.
Yeah.
We do know that almost everybody, we do want at least 1 to 2 to see a rim of white coming through their mouth, because you have the eyes that are white, you got the mouth that you're supposed to have some white. You don't want it all dark there.
Yeah.
That's a simplified one, I guess.
There was a question, which I think is a good multidisciplinary answer, is what do you do for a gummy smile? And that is so dependent, because you have to figure out, is the patient gummy because of a short lip, because of a long maxilla, because of short teeth, or because of extruded teeth? And so the answer with that kind of goes back to Bill Robbins and what you have to fix. So there's no real everything answer for that. It depends on what is wrong, what is causing the gummy smile. And it could be actually that everything is in the correct position. You just have a hyperactive lip. So it's the teeth are the correct size, the lips the correct size. It just moves too much. So yeah, that's a hard answer.
So here's another question from Dr. Rodrigo Monardes. So most people, when I talk about lip lift, they're scared about the scar. This was the fear, and still is the fear, as the history of lip lifts have gone. For the past 25 years or so that they've been around, people were scared to do it because you get a scar or effacement of the nose or changes in the nose or an imbalanced lip lift. The newer technique, which is one that I developed about 5 years ago, is called the modified upper lip lift. It's a deep plane upper lip lift, which ensures that in the worst case scenario, when you do it properly, in the worst case scenario, the scar is barely visible. And that's the worst case, meaning if you're
And I've
talking to
seen your
somebody,
cases. Yeah.
yeah, yes, you can find the incision, but you really have to look for it. You have to stretch out the nose and find it
Right.
that way. If you're
Look
talking to
under their
somebody,
nose.
yeah, you're not going to see it. So if people ask about the scar, you can tell them that yes, if it's done improperly, you will fall into the same basket as all these other thousands of people in the past 25 years. But if it's done properly with either a very, very good surgeon or the proper technique, which I would say is the deep plane technique, you are going to have a very minimal scar that can also be improved with laser over time.
Someone asked, why do people that have veneers have sensitive teeth? Oftentimes that's because the veneers are done incorrectly. So the teeth aren't sealed correctly, or maybe a rubber dam wasn't used. So at the time of placing the veneers, there was some contaminant in there. But that usually means that there's a problem with how the veneers were done, or the teeth may need root canals. Those are the two answers on that.
Okay. And do you lose natural movement of the top lip after a lip lift? If you do it properly, let's say the way that I do it, you will have some limitation in movement for the first 3 months. And after that, you may feel limitation in movement, but it actually looks normal from everybody around. The exceptions to this are silicone infiltrated or fat infiltrated lips. If you have silicone in there, silicone is its own animal, and it takes a while for the inflammation for that to calm down on its own. But otherwise,
I've seen you pull that out of people's lips
yeah,
in your practice.
yeah. So silicone, please never put that in your lips if you can get away with it. So we can get away without doing it.
Someone was asking, isn't a resin smile makeover a better option? It can be. It depends on the case. If you need to really change color, it's difficult to do that with resin because you have to make it so thick and then it looks unnatural. But yeah, for like younger patients, or one or two teeth, or you just need this side to be a little bit wider or longer. Yeah, we love doing handmade composites or the injectable technique.
So I've heard that women's teeth can shift during pregnancy. Is there truth to this?
That would really only be if they have extreme bone loss or periodontal disease, which can happen in pregnancy because your hormones are kind of going crazy. But if you didn't have like extreme perio disease before, your teeth probably won't shift. But the teeth are always kind of subtly moving, which is why even after you have orthodontics, you have to wear a retainer the rest of your life, or else your teeth will move.
Okay. So we'll take maybe like 2 more questions. So I do have a sad mouth. Can that be changed with a lip lift? Typically, sad mouth, or RBF, which is what people refer to as resting bitch face, they come from shadows around the mouth or contracture around the mouth. So yeah, the down pull could very likely be from different muscles down here that are hyperactive, and they're not allowing the mouth to relax as you talk, and it pulls down and creates shadows, and usually a deep sulcus mentalis as well. And that happens very often with people who have too much dental prominence, where it's difficult for their mouth to close in a relaxed fashion. That's probably the most common I see. So the lip and the lower lip, upper lip and lower lip, they come and meet in the middle to close the aperture. If the upper lip are too prominent, or the lower teeth are, then the upper stays up here and the lower has to come close the mouth by pushing up. And it does that.
That muscle gets a pump every time.
Yeah, exactly.
Yeah.
So they get something called peau d'orange, orange peel skin. They get the DAO hypercontraction, and they start to get kind of a down pull around their mouths, or they're just hyperactive talkers. The other reason I've seen is from buccal fat removal. You can get a marionette depression over there pretty substantially, and otherwise just with like drooping over time, the side of the mouth can kind of fall. So first you play with Botox and fillers. Lip lift in certain scenarios can help, and a corner lift in certain scenarios can help too. It really just depends.
Yeah.
Yeah, so we got lots of questions coming into the wrong place. So if you guys have any questions, try to put them in that box. It's easier for us to see them. The next one is, are you coming to Argentina someday?
Don't tempt us with a good time.
yeah, let's hope so. All right, so those are complicated questions. So I would say, unless there's any interesting ones you have over here that you can answer.
Wait, someone was saying something about braces. Let me see what this says. I've had a weak chin. This is a good one. I had a weak chin and went to perform jaw surgery to fix it. I know I have to wear braces. Can I wear braces after the surgery, or do I need to do it while I'm having the surgery? Good question. So we do the braces beforehand to get the teeth aligned with each other, so that when the orthodontic surgeon goes in, they just kind of put the teeth together in the correct facial position. So it's best to do the orthodontics beforehand, and you have to do a little bit afterwards to hold everything in place. But yeah, do the braces before. And it's great that you're considering braces and orthodontic surgery, because it will change your life.
So another question was, is there any other way to perform a lip lift, or do you use Botox to form a lip lift? So I am aware of almost every possibility of things that you can do for the upper lip to lift it. The only two that I've seen is that rhinoplasty in certain situations can bring the lip a little bit higher depending on how you move the base of the columella to the septum, and the other is a lip lift. I haven't seen anything else that works. I've seen many things attempted. I've seen plasma pen, does not work. I've seen the plasma laser, does not work. I've seen thread lifts, does not work. And these aren't maybe, I'm giving you a fact. So those are facts. Anybody you see doing it, it's cute. It's that they do it. And I think it's entertaining and good for a video where you do those little dots or something. But it does not lift the lip to any real extent in the world. So then you look at Botox, and everybody's going to say, well, my friend told me that her lip got lifted with Botox. That's the most common thing that I hear. No, it's not lifting the lip. Botox, in most cases, is going to drop the lip and help a gummy smile. So you inject it here, down over here, and it can relax the muscles that lift, and they relax a gummy smile. If you put it along the border of the lip where the orbicularis has a sphincter action, like that, you can perform the opposite, which is it kind of relaxes it upwards in what we call a lip flip. But it's not a lip lift, so it just relaxes it a little bit. And if you do over a couple of units, you're going to have trouble making the sound of B's and P's. So not always without sacrifice. So lots of questions coming, but I'd say at this point we wind it up. We're close to Instagram cutting us off.
Yeah.
What we're going to do with Kyle, because he's got such a wealth of knowledge, is try to do another session for doctors who are watching. I highly advise that you come to one of the joint meetings that is all-encompassing for plastic surgery of the face, as well as dentistry, orthodontics, and don't think for a second that you're going to be bored in these things. They're like 1 or 2 day seminars, and when I'm there,
everybody's listening the whole time.
The whole time, and other ones. Yeah. When I'm there, I just can't stop watching, and even the lecturers I've seen, like Bruno and Eduardo Mann, and I've seen their lectures, but they change them every time, and it's like seeing a comedian you like. Like every time they've got new material, and I learned so much. So I would highly advise that you guys try to go to those lectures. They're either set up by Kyle or by Chris Coachman, as part of the Digital Smile Design group, or Orofacial Club. We have different ways that we do it. Dr. Kyle, again, Dr. Stanley is located on Sunset, and he's in a group with Matt Najad and Ed Helms.
Mark Helm.
Mark Helms.
Yeah, it's okay.
Yeah, all amazing practitioners. So if you like, we'll have another session, and we'll go through more Q&As. But for now,
we can do Q&As.
Yeah, but I appreciate having you, and we're going to put this broadcast on the YouTube podcast soon, and hopefully you guys can find it there. Otherwise, it'll be on the Reality Pills site as well, probably next week. All
Cool.
right, thank you so much.
Thanks,
sir.
everybody.
You're the best.
Thanks, man.